Another edition of Living Well with Adena. My name is Dr. Kataka, and I'll be your host and moderator tonight for this town hall over COVID-19 vaccinations. We have some wonderful guests to help us through and understand all of the nuances behind the vaccination process. As you may be aware, last month, Adena Health System started to vaccinate its frontline caregivers and employees. This week, following the state of Ohio's plan for vaccination, Adena began the process of vaccinating those in Phase 1B at the PACCAR Education Center located on Adena Regional Medical Center campus located in Chillicothe, Ohio. The vaccination process is by appointment only at this time. The health system began contacting its patients and putting them on a list to be vaccinated this week. Vaccination appointments can be made by calling Adena's COVID-19 hotline, which is 740-542-SAFE, or by going online at www.adena.org/COVID vaccine. We'll be providing that information for you at the end of this COVID town hall as well, in case you need to get that information again. The vaccination will be at no cost to the public. We, as always, want to hear from you. 2 weeks ago when we held this town hall, we received lots of questions and comments. Feel free once again to insert those comments and questions in the box below. We do have staff that are available ready to get those questions for our guests this evening. I'm pleased to announce or introduce to you Dr. Kirk Tucker. He serves as our Chief Clinical Officer for Adena Health System and has really been the powerhouse behind getting the vaccinations rolling out. Welcome, Dr. Tucker.
Thank you, Dr. Tucker. I appreciate the opportunity.
Absolutely. We're joined also with Seth Haynes. He is the Director of Quality and Performance Improvement at Adena Health. Welcome, Seth.
Thank you, Dr. Tucker. Happy to be here.
And we are thrilled to have with us two of Adena's board-certified allergists and immunologists, Dr. Adena Isham. Welcome, Dr. Isham.
Hi, thank you for having me.
Yes, we're glad you're here. And last but not least, we have also with us Dr. Rekha Ravidran. Did I say that correctly?
It's Rekha.
I wanted to make sure. I apologize for that. We welcome you on the show and glad that both of you here to lend expertise. For the viewing audience, we want you to know that they've done a lot of research on their own, and they're going to be a valuable resource for you during the next few minutes to understand some of the myths out there and help you feel more comfortable in getting the vaccine. So let's just dive right into it, shall we? Dr. Tucker, when we last spoke on this meeting or at this venue, Adena was only administering the vaccine to its employees. Help us to understand what changed at the state level that now allows Adena and others in the state to start to roll this out to the general population.
Certainly, the state has directed very prescriptively who is highest in priority to get this vaccine. The very beginnings of this were certainly those who were dying most frequently of coronavirus, which is those folks that are long-term residents in nursing homes and the staff that serves them. So they were originally top priority for the state of Ohio. Following that was the healthcare workers, so the folks that you would depend upon should you fall ill with coronavirus to help save you. And so that was called Phase 1A, designated by the state. They gave that about 4 or 5 weeks for us to get through as many healthcare workers as we could. And then they began 1B designation, which in total means everybody 65 and over or those with certain chronic advanced medical conditions. The governor and the State Department of Health have decided to try to prioritize the most vulnerable to this. So that would be folks 80 and above. And that began this week with the vaccination program statewide for folks in Ohio that are 80 years or older.
Dr. Tucker, can you go into a little more detail about how Adena is actually offering it? What's the process that you're actually going through to operationalize this?
Sure. So we have gathered a team of probably more than 20 medical workers, nurses, pharmacists, physicians to be available at the PACCAR Medical Education Center here on the main campus. And what folks do is either through the phone number that you've posted or our website, contact us to place your name on the list of somebody who wants to receive a vaccine. When you do that, we will call then and schedule you an appointment, date, and time. And when you're here, you'll walk into the building where you'll be registered. Your information will be collected. Then you're walked into a first room where you are seated and go over the process and get the actual injection. They wipe your arm with alcohol, then inject it into your shoulder. From there, if you're doing well, we walk you over to another room where we ask you to wait for approximately 15 minutes. That room is staffed by nursing staff from the hospital to make sure that nobody has any reactions or faints. After 15 minutes, if you're feeling well, we excuse you with a card and a reminder that you've been scheduled for your follow-up injection 3 weeks from that day, and you're scheduled to return at that time. So it's been going very smoothly.
Is it important that the patient keep that card that they're given?
Yes, everyone's going to want to keep this card. As a matter of fact, some of you might even have your polio cards from the 50s. This one looks very similar. This card comes from the CDC, and the type of vaccine you got it and the date that you got it is written on this card. Then when you come back, they write the second shot down on that card, and your vaccine series is considered completed. So you'll receive this card when you come out for your vaccine. I would put it under a magnet on your refrigerator in a very safe spot to make sure that you keep that. That will sort of be your proof that you've been vaccinated.
Dr. Tucker, can you speak a little bit? So there are two vaccines, I believe, that the public is aware. There's a Moderna vaccine and there's a Pfizer vaccine. Which one's the public receiving, and why is it important to know which one you got?
Yes, so it's important to know which one you've got because you want to get the same type of shot both times. If you got the Pfizer vaccine for the first injection, you want to get the Pfizer vaccine for the second injection. You do not want to cross those over. So for the vaccination of all of our healthcare workers, we were given the Moderna vaccine by the state of Ohio, and we vaccinated approximately 2,000 healthcare workers here at Adena. For the public vaccination priority, the state has given us the Pfizer vaccine to proceed with that. Now, for various reasons, it's possible that over the coming weeks you might come here, and that day we would be using the Moderna vaccine for the public. Another very important reason for you to keep your card so that you have evidence of which vaccine you received. Certainly, we will be keeping our own records so that we know which vaccine you received. But you can imagine there's folks out there who might be in Ohio right now, but in 4 weeks, 3 or 4 weeks, be in Florida for whatever reason. And should that be the case, you're definitely going to want to have your card that identifies which vaccine you got on which day.
Dr. Tucker, we're already getting questions in from our viewers. The first one is, can anyone register now? We did mention that the phase 1B at the moment is 80 and above, but would you encourage everyone to go ahead and register and get their name on the list?
At this point in time, we are building a list, and the governor is releasing these folks by age groups, approximately 5 years of age per week. So next week, I would assume that we would start collecting the names of those 75 and above and start vaccinating them the week after 70 and above. So we can certainly, if you call us or contact us, begin to place your name on a list because eventually we're going to be getting to those 65 and above. Now, those folks that are, younger than that, I think you probably have some time to wait to get on the list. But certainly if you're 73 years old and you want to get your name on a list, call the number or put your information in the website. We'll begin building these lists, and everybody who registers with us will eventually get a vaccine.
How many people have already registered is another question coming in from a viewer.
As of yesterday, I believe we had over 1,200 patients registered in the 80 or up category to receive the vaccine, and that's growing daily. I imagine it's even larger today.
So again, once again, to the viewers, we encourage you to go ahead and call that number or website. We'll put that up again at the end of the show so that you can get that. We encourage you to go ahead and put your name on that list now. Seth, let's ask you a few questions regarding Region 7. So we've been on this show before, and we've talked with our CEO and President Jeff Graham about Region 7 and how the state organized themselves. Can you talk and remind the viewers a little bit about what Region 7 is, What's your participation as your role of director in Region 7? And what is Region 7 doing together to bring about the distribution of the vaccine?
Region 7, the Ohio Hospital Association, has designated eight regions across the state. Region 7 consists of a number of different counties: Ross, Pike, Scioto, Hocking, Perry, Vinton, Athens, Jackson, Lawrence, Guy, and Meigs counties. So it's quite large, really encompassing kind of southern, southeastern Ohio. We've also worked very closely with both Highland and Fayette counties within southern Ohio. We've also been working with Holzer Health System, Southern Ohio Medical Center, Fayette County Memorial Hospital, and King's Daughters in Portsmouth since about April of 2020. We've all collaborated together recently with vaccine distribution in Southern Ohio. We're really trying to standardize our approach for each county following the Ohio Department of Health's guidelines for distribution. Our standardization efforts include communication, scheduling, and site locations to give the vaccine. We're trying to make this as seamless as a process for our community as we can by following the Ohio Department of Health's guidelines so far.
And how have the partners been in participating? Has it been helpful for them as well? And are they energetic in joining this process with you?
Yeah, it's been a great collaboration. Like I said, we've worked with 3 other health systems at this time. It's been really nice sharing best practices with one another so we can best serve our communities.
And Seth, can you tell us to the community, can you let the community know kind of what the vaccination really means to you on a personal level?
Well, I tested positive for COVID on December 16th. I'm a healthy 37-year-old, although Dr. Jack Burno has told me I could be even healthier if I would start exercising more, but I've never been hospitalized in my life. I've actually only been to an ED once in my life for nothing serious. Really, during the first 5 days after testing positive, I had very severe flu-like symptoms. And I had all COVID symptoms minus losing my taste and smell that you've heard of. After day 5, though, I went to the ER here in Chillicothe because I started having, really bad shortness of breath. It really progressively got worse until Christmas morning when I woke up at about 5 a.m. I was really trying to make it to watch my 3-year-old and 7-year-old open their Christmas presents. But I probably, but I couldn't make it any longer because my oxygen level had dropped to about 85%, and I was really gasping to try to breathe. Probably waited a day longer than I should have before going back to the ED. I was then admitted on Christmas Day, and I was hospitalized for 5 days. I was very scared for the first 48 hours because at one point my oxygen had dropped under 70%, and I was put on very high flow oxygen to maintain my level at 90% for several hours with nurses constantly monitoring me. Honestly, Dr. Kataka, I thought I might die in the place that I was born in 1983 without any family by my side and not being able to watch my kids grow up. And that still, just to think about it right now, it just kind of upsets me. I received the best care and treatment from our Adena 2 Northeast team and hospitalist, Dr. Keister. Dr. Thomas checked on me a few times because she's a family friend. I received the full regimen of treatment: plasma, steroids, remdesivir, and then I was able to go home after 5 days. I still have bilateral pneumonia and other lingering COVID symptoms, but I feel much better now. And I want to thank all of my family, friends, and people who are praying for me in the community. It really meant a lot, and I really think that helped get me through this. So our family really has taken everything with COVID very serious, with masking, social distancing. But I hope my story that I'm sharing with you today puts into perspective that this virus is unbiased to who gets it, how it might impact you, no matter your age or how healthy you are, and also who you might unknowingly pass it to. I urge you to sign up on our website to get the vaccine, and when it's your turn, come get it, and to also encourage others in the community to do the same. The vaccine and continuing our good hand hygiene, masking, and social distancing is the path to ending this pandemic for all of us.
Thank you, Seth, for sharing that very personal story with us. We're glad to see that you're recovering and doing well. And again, your words, coming straight from someone who's suffered this illness and was hospitalized. I can't imagine even on Christmas morning having to do that and living through that. So thank you for your words of encouragement to get the vaccination word out. We appreciate you, Seth. And we also appreciate all that work that you're doing with Region 7 and also with our other health system partners in the region. So thank you very much. I'm going to turn my attention now to Dr. Isham and Dr. Ravidran. We're glad that you're with us. Again, for the viewers, we want the viewers to know that you've actually both received the vaccinations, correct? Is that right?
Yes.
Awesome. So, Dr. Isham, let's talk first with you. There's a lot of news, and there's a picture of the two of you being vaccinated or after being vaccinated. There's a lot of information out there, Dr. Isham, some of it correct, some of it not, in social media and other places, that people know that this is some type of genetic vaccination and it works at the cell level. And there's some concern out there that perhaps this interferes with your genetic makeup or somehow can cause damage to your body. Can you walk through with us what the vaccine really is, and is genetic changing a real threat?
So first of all, it is not a threat at all. There are no concerns about it affecting our DNA. So how this vaccine works is, imagine it like a fat capsule. You can imagine like an olive oil or vegetable oil capsule. So it's a lipid capsule that contains a small amount of the mRNA, which is some genetic code of the virus. So our body takes that up and into a cell, and it does not go into the nucleus of our cell, which is where our DNA is located. So this mRNA only goes into a part of our cell and then our body sees that. What it does is it causes that cell to produce the spike protein. So the mRNA is not the entire makeup of the COVID vaccine. It is specifically only the spike protein. So it allows our body to make that spike protein on those cells so that we can create antibodies, basically our army against the infection. And so that way, and then the mRNA is dissolved and gone. So it doesn't stay around. Once it is used, it's gone. It never touches or goes anywhere near our DNA. And then it basically just teaches our body how to recognize specifically the spike protein. So in these particular vaccines, it's not even looking at the whole virus. It is only teaching it specifically the spike protein, which is common to this, no matter, like for example, a lot of people have heard about the UK strain. So on that UK strain, it was a mutation a little bit on the spike protein, but we believe that the vaccine is still going to recognize, so our antibodies will still recognize that strain. And so in no way will it affect our DNA makeup.
So it's tricking your body and thinking that the virus is there and developing the antibodies. Is that a fair thing to say?
Yeah, it's not even the whole virus, just the spike protein. So it's tricking our body into thinking just the spike protein is there. And so then your antibodies, which are what fights infection, will be created. They stay around, and getting that second dose is a booster to really give a good encouragement for those antibodies to stick around longer and to have a better response. And so that's why it's this particular vaccine is a 2 vaccine regimen.
And Dr. Isham, just to clarify, is that true? Is it 2 doses both for Pfizer or Moderna, whichever one you start off with?
It is, absolutely. So both vaccines you will receive 2, and the Pfizer vaccine is 3 weeks apart. The Moderna vaccine is 4 weeks apart, and I've already gotten both of them.
And how'd you do? How'd you feel?
The first one, I was just, Rick is laughing. So the first one, my arm was pretty sore, which I expected, and that's really common in both vaccines. So you really are going to expect to have that in both vaccines. After the second vaccine, with the Moderna vaccine, I did have definitely chills, some fatigue, muscle aches, mostly the evening after I got my shot, and some the next day. mostly it was, and I even had some nausea with it. So it was mostly just for a couple days, and now I'm back to normal. I feel back to normal again.
Okay. And Dr. Ravidran, how did you feel after you got your injection, your vaccination?
So I get number 2 tomorrow, so stay tuned for results on that. But after my first one, I just had some soreness in the arm, and so I just kept moving it around and exercising it. I was laughing because it was on the sheet to exercise your arm to kind of prevent more soreness the next day, and it's not something I thought of. So I read the sheet, I exercised my arm, and I felt great. And the next day, when I saw Dr. Esham in clinic, she was like, my arm is so sore. And I'm like, did you exercise it? And she's like, I didn't know we were supposed to do that. And so the second time around, I think she did that a little bit better. And
So a helpful hint for our audience that when they receive those vaccinations, move that arm around, get that moving around.
Yeah.
Dr. Ravidran, some folks are concerned that they'll actually catch COVID from the vaccine. Can you help us to understand that better?
So a lot of what Dr. Esham was explaining, so the COVID vaccine does not have the entire virus. It only has that coding for that teeny tiny piece of it. So what your body is seeing is essentially that just that spike protein, but the spike protein on itself is not the whole virus. So you can't contract COVID from the vaccine. Now, that said, if you get your vaccine, it is still important to socially distance. It's still important to wear your mask because you don't make that immune response and appropriate antibodies to neutralize COVID if you got exposed to the virus right away. It usually takes about at least 2 weeks to start to make those antibodies. So if you get the vaccine and you're exposed to COVID, you may end up having COVID because you haven't made that appropriate response if it's pretty early on. But that didn't come from the vaccine itself.
Thank you. Dr. Isham, we've heard some reports of some allergic reactions, particularly in the small numbers to the Pfizer vaccine. I'm not aware so much with the Moderna vaccine. Can you help educate us about, are there allergic reactions? What concerns should the public have? And how serious are some of those reported incidences?
So there were, up to date, there were roughly like 28 allergic reactions reported to the 2 vaccines, one to Moderna and then the others to the Pfizer vaccine. The Moderna reaction was a patient that they reported he was a physician, had shellfish allergy. That had nothing to do with it. He did self-treat with epinephrine, was released from the hospital without any problems. The other Pfizer reactions that we've seen more with, that initially we heard a lot about those initially. Everyone was treated appropriately and released without any long-term side effects. These were a lot of self-reported, and so there's a little bias in that. And then on top of that, once a few started coming out, everyone is, very hyped about getting it. And so there was, it's often hard to tell when you get a vaccine or a shot in general. Some people have flushing, and some people might feel lightheaded. So some of these reactions were hard to tell if they were true anaphylaxis or anaphylactoid, is what we call it sometimes when it's not true anaphylaxis. So, if you've had an allergic reaction to the first dose, then it's recommended that you don't take the second dose. But regardless, I think if you have any type of reaction with the first dose, I think it's important to meet with an allergist so that you can kind of talk about your reaction and decide whether or not the second is appropriate. For example, I had a patient today who did have a rash after her first dose, and we talked about it. We talked very specifically about her rash, timing, all of those things, and decided that the second dose would be appropriate. So even if you do have some type of adverse reaction with the first dose, I think it's important to talk to an allergist first before deciding not to get the second.
And if I heard you correctly, Dr. Isham, you said there were 28, and that's out of millions of vaccinations that have already occurred. Is that correct?
Correct. So, the rate of that is very low. A little higher than the flu vaccine, but the rate is still very low. So rare, very rare, and none of them have been, have caused any adverse outcomes. So we do recommend that if you have any, previous reaction to any injectable medicine, that you talk to your family doctor or an allergist prior to. If there's any, concern, we recommend waiting 30 minutes rather than the standard 15 minutes. But if you have, so if you have food allergies, insect allergies, latex allergy, seasonal allergies, that type of thing, that does not put you at higher risk for having an allergic reaction to this vaccine. So we've had a lot of misunderstanding that patients with asthma or allergies, food allergies, that type of stuff, should not get this vaccine, which is absolutely not true. So your risk, if you have those type of allergies, is the same as the general population. And you don't even need to wait an extra, the extra time. It's really still just the standard 15 minutes.
That's great to know. Thank you. Dr. Ravidran, this has been called the development of this vaccine, the emergency use approval, and the distribution of this vaccine has been actually called Operation Warp Speed. That has led some people to believe that this process has been rushed. Can you walk us through the difference between expedited and rushed? And do you feel that this vaccine, were there any corners cut in the development of this vaccine?
So there wasn't. So mRNA vaccines, even though these are the first two that have been FDA approved for use in the United States, they're not the first two that have been in development. So the idea of mRNA vaccines have been around for decades, and they really were focusing on doing those for like the Zika virus, the avian flu, and they actually have several of those vaccines in trials now. Now, in expediting the process, we still, for the COVID vaccine, since it was an mRNA vaccine that we knew the technology, we took that technology, and then we took the knowledge that we had of coronaviruses to pick the part that was probably going to be the best to help neutralize the infection, so the spike protein. We took all that information to develop it, but they still went through phase 1. They still had to enroll patients. They had to watch for side effects. They had to check to make sure antibodies were produced. So all those things did happen. So it wasn't that any corners were cut from that, and this wasn't brand new technology. We really were just piggyback on stuff that we already knew did work and have been working in these other trials for these other vaccinations.
Dr. Isham, what is the effectiveness of either of these vaccines?
So the current vaccines that we have for both with Pfizer and Moderna is amazing. So the effectiveness is 94.5% in Moderna and 95% effective in Pfizer, which is really astonishing to have a vaccine that proved to be that effective after 2 doses. After the first dose, Moderna reported 80% effectiveness 2 weeks after your first dose, and then 95 or 94.5% after your second dose. I think 10 to 14 days after your second dose. For the Pfizer vaccine, they reported 50% protection after 10 days, I think 2 weeks after your first dose, and then 95% effective after the second dose. We don't know at this time how long that effectiveness is going to last and if it will wane over time or not, but that's why the second booster is given in hopes that does not wane, that does not decrease, over a time period. But certainly as time goes, we will have better numbers on how long our antibodies are going to last for those.
The future, what's going to happen in the fall or next year or beyond. Is that correct? More development or more research needs to be done?
I'm sorry, I missed the first part of your question.
Yes, I'll repeat that, no problem. So more research will need to be done to whether or not we'll need to have a booster in the fall or what's going to happen in the following years, that type of thing. That's not quite known yet, is that right?
No, it is not known. And it also is going to depend on how this virus acts. So, it may be something where it mutates to a point where they need to adjust it. And because it's an mRNA vaccine, it's actually going to be pretty easy to adjust and then remanufacture, which is exciting. But I think that's just going to depend on what the virus does and then how our bodies retain that antibody over time. And we'll know more over the next 6 to 8 months.
Okay, and we have a question coming in from the audience, and I'll read that here. The question is it true that reports of the Pfizer vaccine antibodies create a response to the vaccine, that they will also attack other areas with similar proteins in the body, causing long-term issues? Is that true or false?
No, that is not true. Our body doesn't create spike proteins. And our antibodies that this is making is specifically to the spike protein. And so I have not heard of any concerns or reports of there being, essentially that would be an auto antibody, attacking something else of our own tissue. And that should not happen.
All right, thanks for answering that question. We appreciate that. Seth, we have a question for you coming in from the viewers. The question is, can you sign up for multiple lists? And if so, what does that mean?
Yes, in Ross County, of course, Adena Health System, like Dr. Tucker said, at the Packard Medical Education Center is where you can get the vaccine here at Adena. There is 2 Kroger pharmacies that are offering it, Allen's Pharmacy, and then our Ross County Health Department. Everybody's kind of working off of lists to call. You can sign up for multiple lists, but we really encourage you, wherever you're signing up, to let that site know that you've signed up on another list so they can coordinate together.
Thank you very much. And if you end up getting a vaccination, say at one of those locations, would it be advisable to let the other locations know that you've already started that? Do you want patients returning to the same location, ideally?
Yes. So on our vaccine card, the CDC card, I think that you showed a picture earlier, we're really encouraging that you get, for continuity, if you get the first dose at Adena, then you come and get the second dose at Adena. If you get your first dose at the Ross County Health Department, you go back to the Ross County Health Department.
Thank you very much. And so Dr. Tucker, I'll kind of have you reinforce this. So, with your understanding from the state, are there other options for receiving the vaccine while waiting to be contacted by Adena? Seth mentioned a few, but is the ODH involved somehow? Do they have a website?
Most of these efforts are local. The way the vaccine has been distributed is county by county based upon census population data. So the governor really did try to place these vaccines proportionally in counties where these folks live. So your best bet, I agree 100% with Seth, is to reach out to all of the providers in the county that you live and get your name on maybe 3 lists. We would ask you, though, if you're called by one of them to come and get your vaccine, that you let the other folks know, the other lists that you're on, that you've gotten a location and they can open your spot up for somebody else. So that would be the approach I would use. I would not drive to Columbus or to a major city to try to get on a list any sooner.
Thank you, Dr. Tucker. As we're finishing up our show here this evening, do you have any final comments for viewers and words of encouragement?
Yeah, so when I entered our vaccine site yesterday, I went and got to spend an hour with the teams over there and the patients coming in for their vaccine. I was struck as I walked in the building and looked around and seeing all the activity with the first true sense of hope that I've gotten since this started. I can remember my moment of panic was when all of the schools were closed down and I realized my children were going to be staying home. That was impressed upon me instantly, the gravity of what we were dealing with as a nation and as a planet. Yesterday when I walked in there, I was given an extreme sense of hope that we are truly witnessing the beginning of the end of this terrible saga that has been coronavirus in the United States and on planet Earth. It's important for everyone to understand that as you receive your vaccinations, that, I love Dr. Esham's, the data about, 10 days after your second shot, you're significantly protected. This does not mean that you can tear off your mask and go out in public and walk through Walmart. As we begin to vaccinate more and more of the public, it's going to be important for us to continue to follow the measures we've implemented to date to keep each other safe, those of us who haven't been vaccinated yet. So wearing your mask when you leave your home, social distancing, washing your hands, and not gathering indoors with other folks, really in more groups than your immediate family. We will need to do that, and I'm going to sort of venture a guess, which has always been dangerous throughout this course of COVID, that by this summer and certainly this fall, we will begin to see big semblances of life return back to normal again, hopefully for all of us. And then all celebrate together the day that we can begin to take our masks off and go back to the life we knew last February.
Thank you, Dr. Tucker. Returning to normal can't come soon, I think, for all of us.
Yes,
Yeah,
sir.
we've heard now from Dr. Tucker, our Chief Clinical Officer at Adena Health, and you've heard his final words of hope. We hope that this, and hearing from Dr. Adena Isham, thank you so much, and from Dr. Ravidran, we're grateful for your expertise in helping to dispel some of the myths out there for our community members and helping to encourage all of us to get vaccinated. We do understand that this is a challenging process here in the beginning, but we are very confident that this will improve day after day and week after week, and the ability for us to vaccinate large numbers of people will become a reality very, very, very soon. We want to make you aware of a couple of other, we remind you again of how you can sign up for that vaccination process. So we want to remind you that you can schedule an appointment by calling our number. Again, it's 740-542-SAFE, or you can go online at www.adena.org/COVID vaccine. Again, call that number or go to our website to get your name on the list. You can't do it soon enough. We also want to make you aware of another program that we have available as well, and it's called Lady Parts. And it's a radio show with Dr. Richard Villarreal, who's an obstetrician gynecologist, and he discusses a lot of topics related to women's health. Matter of fact, our guest this evening, Dr. Isham, will also be on his show that will air on the third Monday in February on WKKJ 94.3. Again, that's Lady Parts with Dr. Richard Villarreal, and Dr. Adena Isham will be his guest on February 15th. So please tune into that as well. And then join us back here again for another upcoming Town Hall and Living Well segment that will be on Thursday, February 4th, and more to come. Thank you so much for tuning in and joining us this evening. Please stay safe and have a good evening.